To start, there are 1,087 confirmed cases of COVID-19 in Canada, with 318 cases in Ontario. Chatham-Kent has 2 cases, and Michigan has 552 cases, with 180 cases being in Detroit. We have 1 confirmed case of COVID-19 in Windsor-Essex County.
The case is a male in his 60s who returned to Windsor after traveling on a Caribbean cruise and arrived back in Windsor on March 10th. He has been in self-isolation since he returned. He developed symptoms on March 11th and was tested at the Windsor Regional Hospital Assessment and Testing Center on March 16th. He was a close contact of a family member who was also tested positive for COVID-19 outside of Windsor-Essex County. He is currently recovering at home with mild symptoms. He did all the things right in terms of following the directions of public health, staying home and not going outside, and follow the self-isolation protocol. We'd like to continue to stress that this is one of the cases that we were hoping that will show up in Windsor-Essex, and we were on top of it. We made sure that the person got the information that he needed to ensure that they are following the self-isolation protocol. As we are preparing for the return of March break travelers, we like to strongly urge all residents to practice social distancing, avoid crowds, and close contact with those including immediate family members, as well as staying home as much as possible. Especially if you are unwell, if you have any symptoms, if you are sick, please stay home and contact your healthcare provider or the health unit. This new case also underpins the robust measure that we have been taking to restrict travel particularly outside of Canada. So anyone who's traveling outside of Canada for non-essential reason, they should not travel outside because this is a travel-related case. We will continue to investigate and monitor all individuals who are at a risk of exposure. We continue to encourage residents to take appropriate preventive measures to ensure that they stay healthy, including regular hand washing with soap and water, coughing or sneezing into tissue, and hand washing. Disinfect, and most importantly, staying home when you're sick. All residents, all returning travelers are reminded to self-isolate for 14 days, do not go to work, do not go outside to public places, and monitor for your symptoms. Individuals who are suspected can go through the self-assessment tool that's online as well. In addition, I would like to add what is happening locally as well. So last night, I have issued a strong recommendation that the following non-essential facilities should close immediately. These recommendations will follow by an official order on Monday, March 23rd. It includes retail stores, including those that sell clothing and apparels, books, home decor. It also includes personal services settings, including hair salons, day spas, tattoo parlors, and nail salons. So we are learning every day from other countries and also from other jurisdictions. You rightly said that, we never said that we won't get a case. It's just a matter of time that when we will get a case. We will get more cases as well. So I think the important piece is what can we do to reduce the impact of those cases and also try to reduce the peak of those cases. Like, let's say if we don't take any measures, how many cases we will get? And if we are taking these measures, how many cases we can prevent? I think that's where the focus is, that the majority of the cases we can prevent, that's a good thing for the community. And I think that's what the aim is. All these measures that we are putting in place, we are quite confident that it would reduce the amount of physical contact with the majority of the population, with the school closures, with the facilities closures, with the bars and restaurant closure. It will limit that physical contact with the community, and by the analogy of how these infections spread, we should see a decline in the number of cases in our community.